Welcome everybody to the Second West Berkshire Diversity Forum. Now, with the wonders of technology, he says with his fingers crossed, we should be asking you a question. He smiles, he waits, there we go. So I don't think they're desperately surprising, but perhaps we can pick that up when we get to the panel discussion.
Welcome everybody once again to this West Berkshire Diversity Forum virtual meeting with the topic of how COVID-19 has affected you, your family and the community. We have several representatives from Healthwatch West Berkshire. Chief Executive is Andrew Sharp.
You nearly did it.
Who is
hello everybody,
leading it. Alice is here, Alice Kunjapi Clifton, and they're also trying to make sure I've got everybody. Who have I missed?
Got Michelle and Nathan.
Thank you very much. And there's I'm here representing Community United. Alice is also involved in Community United, as you probably all know. Carol Jackson-Durga was hoping to be here from Community United this evening, but unfortunately she's hit some roadblocks on the technology front, so unfortunately she's not able to join us. Just a quick word on Zoom etiquette. I'm assuming lots of you have already been on Zoom calls fairly repeatedly over the last few months. But just in case you haven't, the important thing is for everybody to be muted unless you're actually speaking. That way there's no extraneous noise coming into the meeting and everybody can hear what everybody else is saying, which is obviously the most important thing. And when you do speak, we'll make sure you're unmuted and you can have an opportunity to speak. The meeting is being recorded, so hopefully everybody is okay with that. So that's an important point to note. And aside from that, I would just welcome you all again and ask you to enjoy it. I think this is an excellent opportunity for us to review where we are with COVID and how it has affected people. And we have some very distinguished speakers joining us this evening. Julie Sigurdardottir, who's a doctoral researcher investigating maternal health at King's College London, is going to speak to us on COVID-19 and the effects on women's well-being. Dr. Seshagiri Rao Nimagada, who is the consultant forensic psychiatrist and medical director at Thornford Park Hospital, is going to be talking to us about COVID-19 and what can you do for your own mental well-being. And we're going to start in a few moments with Dr. Deepak Ravindran, who's the pain management lead at Royal Berkshire NHS Foundation Trust, who's going to talk on COVID-19 and the effects on the ethnic minority and diverse communities. Towards the end of the meeting, we're going to have a panel discussion, which will be chaired by Victor Karoma, who's the General Manager of the Alliance for Cohesion and Racial Equality in Reading. And he will be joined on the panel by Dr. Sarah Rayfield and April Pebbody from West Berkshire Public Health, as well as our other speakers. So a packed agenda, I think, is ahead of us this evening. As I said, I hope you all enjoy it. I think it's going to be a very interesting meeting. And so let's get things underway. And without further ado, I would like to introduce Dr. Deepak Ravindran.
Right. Thank you, Julian. Can you hear me?
Yes, we can.
Brilliant. Okay, I wanted to share my screen. Okay.
You should be able to do that.
Brilliant. Excellent. Good evening to all of you. Thank you for waiting patiently. I will just have the presentation up. And are you able to see this?
Yes.
Yes.
Thank you. Can I just, yes, make it a slideshow and then...
There we go.
Right. Brilliant. We're ready to go then. Okay, so Good evening to all of you, and thank you to Community United and Health Watch West Berkshire for inviting me today to talk on this diversity forum evening. And I think it's a very admirable platform to make sure that our community is included in any conversations like this. Um, I'm very interested in this aspect, not just because I belong to an South Asian community, and I can say that reasonably the same community as Kamala Harris is, or her mother claims to be. And that would be my claim to fame, that there's some kind of link there. But more importantly, there are a huge number of minority ethnic communities that are there in Berkshire, and I see a fair number of them in my pain clinic. I also look after patients in the community via the integrated pain and spinal service. And I worked a lot with Health Watch West Berkshire over the last few years, doing some public awareness events around this kind there. And COVID has had its share significantly on mental health and pain and isolation, and all of that feeds into how patients get a flare up of their symptoms and come into the clinic. So it's quite personal to me. I'm also a COVID survivor. I have at least gone through 10 or 12 days of feeling really horrible. And so I do feel sometimes what the patients have gone through and what they are now going through, some of them in terms of long COVID. I'm qualified in lifestyle medicine as well. So I do tend to include a lot of conversation around lifestyle, and in that, the way our culture generally reacts to a lot of these events, these traumatic events, and how we respond varies from culture to culture, and that also needs to be taken into account. To me, the community is a very important place, and I really like this book, and I would recommend this book to any of you wanting to understand the present state of how the changes in the economy and the market and capitalism has changed around, and why more than ever now community is so important to look out for, to look after each other, and to be there for everyone. And it has played a significant role initially in terms of how the community rallied during the first lockdown, and it plays a big role now during our second lockdown, because it's very difficult to draw balance. And I don't, there are things that our government could have done better, but I think I'm struggling to find any government that has done a stellar job. And I think the balance is always here. Do you go down and do a lockdown and say that you're protecting the NHS, but then you're saving more lives, but at the same time, you're exposing more people to increased problems with mental health, with isolation, communities, ethnic minorities, which often are close-knit communities, now being asked to stay different or stay apart, especially at festival times like this, during Diwali and all of the other festivals that have gone through. At the same time, how do you balance the impact on the economy? I read today that 315,000 UK citizens have been made redundant now, and that's a huge number of people who will not have options there. And obviously, if you look at only the economy, then the deaths are going to be a lot more. So what I do realize is that when it comes to the ethnic minorities, the suffering is more. There has been a lot more impact of COVID itself for a variety of reasons, not just the disease condition itself, for which we are more prone to it, but also from a number of other factors that have come through. I think we have to accept that overall, the UK has realized that there's some level of systemic racism there that is being now looked at very closely and looked at. We know that deprivation is a big issue and that needs to be tackled. And social inequality, again, is an issue that is often the bigger case with ethnic minorities. The household size has been implicated and looked at as a problem. But the biggest thing that has been identified, and my personal feeling, is that how do we get the message? How do we communicate and raise awareness and improve the quality of our communication with ethnic minorities? And I like to say this, we need to find a way to make it culturally congruent, how to make it appropriate and sensitive for the community that we are looking after. So I have chosen today to just focus on how do I spread the message that this is kind of the truth as far as Berkshire is concerned. It is as trustworthy as it can get, and there is reassurance that I can provide. All I can show you is some numbers from the first wave. Berkshire has been particularly a very well-behaved county, if I must say. We have not had that kind of huge mortality from the first wave. And for purposes, we define the first wave as from February to the end of August. And the second wave starts from October onwards. We've had about wave one. Obviously, we have to remember that we have only 500 patients, but we didn't do enough testing, so we do not know that. However, we have had about 183 deaths. And wave two, as of now, we've had about 40 deaths occurring there. The most important point is, as far as intensive care is concerned and people are concerned, I would caution a lot of us in the ethnic minority to be aware that testing means more numbers are tested positive, but that does not mean people are necessarily infectious or they are landing up more sick in hospital. All I can say from our observation here, from the intensive care, from talking to my colleagues in intensive care and talking to my other anesthetic colleagues who look after intensive cares in other parts of the country, in Berkshire, we haven't had that much of seriousness or bad infections or severe infections this time around as yet. We've had only one case in intensive care, and I think that is reassuring in the way our community and Berkshire is looking after each other. There are some issues, and I think each one of you, when I spoke to Dr. Rao, and I've spoken to a few others in our ethnic minorities as to what our concerns are, I would like to reassure everyone that PPE, as far as the Royal Berkshire concerned, I don't think that's an issue at all. We do have adequately for whatever needs to be done. I've spoken to my pediatric lead consultant in the Royal Berkshire Hospital, because schooling and children during the lockdown has been a hot topic of contention given what's happening in countries like Asia and India and in US, where it's all predominantly online. I would like to say that I think it is a bold move, but it is a very important move. And a lot of pediatricians agree with it, that children could be carriers, could be silent transmitters, but the long-term problem of trying to keep children at home is a bigger factor on the parental health, on parental pressures, on the economy as such of what will be involved. And for that, we have no guarantee that there is going to be further protection done. Children itself, from what I've been told by my colleague again in RBH, we haven't had any of the serious problems that have been picked up and have been reported in the media. We haven't had any of those complications or long-term issues that have been reported in a few children. We had only about 12 to 15 children ever admitted in RBH during the first wave, and nobody was serious, I believe, and there were no deaths at all. So it is quite reassuring in terms of what we are doing with children, allowing them to go to school for their own mental and social health and their interactions with other members of the community. Vaccine, there's a lot of talk going around it, and I would like to again say that yes, the NHS may be prepared when it comes there, but the vaccine, by the time it's given to the rest of the population, it's going to take some time. The elderly and the more vulnerable will be given it when it is available. But I think we are still a few weeks away and a few months away, if I may say so, from having something genuine and proven and safe for everything that comes along. I will wait till the scientists actually say how safe it is rather than Pfizer mentioning it. So I will wait for that part there. But it is something we can hopefully look forward to now. So that's a good thing. I think test and trace, the less I say of it is the better, because nobody can say the truth there. But the safety of hospital travel, I'd like to reassure everyone that as far as the Royal Berks is concerned, if there is some other problem going on that you need to talk about, that you need to discuss, the Royal Berks and its satellite units in Thatcham, Newbury, Bracknell are as safe as they can be. I would encourage you to not get worried or to stay because you're worried about it. If there is another genuine health issue or screening, we will be able to look after it really safely and do the right thing. My interest is in long COVID or symptoms of people having problems around fatigue and pain with this even after 12 weeks. And now we've got some good idea that there will be some services available like that. So if you know relatives, friends within the ethnic minorities who may be struggling with lots of fatigue and breathlessness and chest pain and other symptoms after having had COVID, or symptoms like COVID during March or April but still struggling, then please be ready that in the next 2-3 months, we should have a service locally that will be able to offer some support, assessment, and triage. We're in the process of getting that done. My main interest is that with the pillars of good health and lifestyle wise that I say, it's very important that we pay attention to these 5 pillars of nutrition, movement, sleep, relaxation, most importantly, community and social connection, because whether it's a viral infection like COVID, whether it's the after effects there during this period of lockdown, please pay attention to that element of nutrition. Keep sure that you're making good movement, ensure that there's strategies for relaxation, and ensure that with working from home, you don't compromise on sleep. And please make sure that you use Zoom safely and as much as possible. If physical distancing is one thing, social distancing does not need to happen. We are looking and we will be looking to you, and I'm going to be asking you during the panel discussion, and I'm going to look at my other colleagues as well to actually ask, how can we improve the access and experience for the message and the communication to reach the ethnic minorities more effectively? How can we get more information out around health promotion, around lifestyle, around COVID and post-COVID management? And actually, I'll be very interested with my pain management hat on for the Royal Berkshire community. How do we get information around COVID-19, around long COVID, around pain itself, how to look after it, when to reach out for help? How do we do that in a culturally sensitive manner? Because I know how a Hindu, how an Asian, how a Muslim community, each one receives information and absorbs it is different. And I will look forward to what you have to say in there. Thank you.
Thank you very much indeed, Deepak. That's a lot of extremely valuable points and lessons there. I'm looking forward to the discussion on that later on. Just on the point of the discussion, if anybody does have any questions that arise during the course of the evening, please do put them in the chat, and we'll make sure the questions then go to the panel of speakers at the end. So feel free to put your questions in the chat as they occur. We may not get you answers until the end, if that's okay. But hopefully that will help keep things moving along. So